Good afternoon, everyone. The topic of my presentation is the spontaneous globe rupture, an unusual complication with the dengue hemorrhagic shock syndrome. Dengue is transmitted by Aedes mosquito. If, it starts from the asymptomatic febrile illness to fatal hemorrhagic fever. Severe dengue hemorrhagic fever is characterized by the extensive plasma leakage manifested by the fluid extravasation in the lungs and abdomen, involving the multiple organs leading to respiratory distress and dengue shock syndrome. So the child was 9 years old male, presented to pediatric emergency with high grade fever, abdominal pain and vomiting for 7 days, altered sensorium 6 hours before presentation, history of 2 random platelet transfusion in few days. And there was normal developmental history. The child was lethargic, not oriented to time, place and person. Vitals were unstable and BP was 80/50 in right arm in spine position, and DC score was eye opening 2, vocal response 2, and motor response 5. Ophthalmic consultation was done in view of the acute right eye swelling. So visual acuity and the digital tension could not be assessed because of the altered state of consciousness. Eyebrows bilaterally symmetrical, visual axis and ocular movements as he was altered state of consciousness. And the acute abaxial proptosis with no variation in posture associated with periorbital edema. Skin was warm and tender to touch. There was no leg ophthalmos, no dilated episcleral vessels. Hemorrhagic chemosis involving the inferior palpebral conjunctiva was present in the right eye, left eye was normal. And the details were not pupil lens and fundus were not visible because of the full blood, fresh blood hyphema in the right eye, and cornea was with the dull luster. So on the presentation, we can see in the picture diffusely illuminated clinical picture of the right eye. On the first examination showed the anterior displacement of the right globe, hemorrhagic chemosis, dull cornea and mid-dilated pupil with the hazy media. And after 2 hours of first presentation, we can see the blood on the medial side, full chamber hyphema and extensive hemorrhage was noticed near the limbus after the 2 hours of first examination. So contrast enhanced MRI imaging was and orbit were done to rule out the intracranial bleed at the globe rupture. And this is the picture showing the proptosis in the right eye, and we can see in the hypertense various echoes in the right eye showing the hemorrhages, retinal hemorrhages, choroidal hemorrhages, and we can see the proptosis in the right eye also. And this MRI shows imaging the right eye with interior displacement of the globe with the punctured right eyeball as compared to the left eyeball, which looks like well formed the left eye, but the right eye looks punctured, and the hypertense and the hypoechoic echoes in the right eye. So the multiple hyperintense lesions were present in the bilateral ganglionic and the left subcortical white matter region on T2. Dynamically, the TLC was 18,000 cubic per millimeter, and the platelets were 45,000 after that. And possible mechanism for the globe rupture could be the increase in intraocular pressure, which is evident from the apparent enlargement of the eyeball, as seen in the radiological examination. Increased intraorbital pressure, which results in dilatation of the retrobulbar space, secondary to the retrobulbar and suprachoroidal hemorrhages. In this picture, we can see the break in the continuity of the outer wall of the right eyeball with extrusion of intraocular contents is visible in the sagittal section. So the patient was diagnosed as dengue hemorrhagic shock syndrome and started on supportive therapy with the platelet transfusion. The topical medication in the form of dorzolamide and timolol was started because of his systemic condition. We were not able to do the lateral canthotomy. Intravenous methylprednisolone was given in view of immune-mediated pathology. IV mannitol and other hyperosmotic agents are contraindicated due to deteriorating blood pressures. Canthotomy was deferred because of the to avoid excessive bleeding. The child was conservatively managed with antibiotic eye ointment, pressure bandage, and ultimately the child succumbed to extensive systemic involvement in spite of aggressive management. Dengue fever is self-limiting with less than 1% case fatality. But if not treated adequately and early, the mortality can be as high as 20%. Prognosis in dengue hemorrhagic fever and dengue shock syndrome depends upon the prevention and early recognition and treatment of shock. Although the pathogenic mechanism of ocular complications associated with dengue fever remains unclear, the mechanism is believed to be immune-mediated rather than direct viral infection. So these are the two case reported which are given in the references. The cases are already been reported in adults. Um, the spontaneous globe rupture, a case series, and the one case report by the Chatraj Jaydev and Nagaraj of the spontaneous globe rupture. But this is the first case reported in a child. Ophthalmologists and a pediatrician should be alert regarding the vision-threatening manifestations related to dengue hemorrhagic shock syndrome. Timely diagnosis and early management can improve the outcome of the disease. This case has been published in the American Journal of Ophthalmology case reports. Thank you.
Yes, thank you. That's a very rare case you've presented. It is very unusual for a normal globe to rupture. In cases of absolute glaucoma, when the sclera is very thickened, we can have, but a normal globe to rupture is very rare.
Yes, ma'am. Normally, we in the OPDs we usually see the subconjunctival hemorrhage in the retinal blades, but such type of a presentation was just alarming to us also, and just presented because this can occur. No, sir, he was not having. Yes, sir.